Chemotherapy. Chemotherapy involves using anti-cancer drugs to destroy cancerous cells. For mesothelioma, chemotherapy is usually given systemically, entering the bloodstream to travel throughout the body. It is often used alongside another treatment like surgery. Platinum-based doublet chemotherapy combinations using drugs like cisplatin or carboplatin plus pemetrexed, Alimta, are considered the standard first-line treatment for unresectable malignant pleural mesothelioma. The goal of chemotherapy is usually to shrink tumors, reduce symptoms from tumor growth, and potentially prolong survival. However, chemotherapy cannot cure mesothelioma. Common side effects may include fatigue, nausea, vomiting, diarrhea, hair loss, bruising, bleeding risks, decreased immunity, neuropathy, tingling/numbness, and sometimes even organ damage with long-term use. Doctors closely monitor patients on chemotherapy. Radiation therapy. Radiation therapy uses high-energy rays, X-rays, gamma rays, or particles to damage cancer cell DNA and destroy cancer cells. For mesothelioma, radiation is typically used as palliative treatment to help relieve pain, dyspnea, shortness of breath, chest wall pain, etc. from tumor growth, putting pressure on vital organs. Radiation may also sometimes be given as part of comprehensive treatment along with chemotherapy and surgery. Different types of radiation therapy used for mesothelioma include external beam radiation therapy, delivering radiation from a machine outside the body, internal radiation therapy, brachytherapy, placing radioactive material inside the body near cancer, and proton beam therapy. Side effects may include fatigue, skin irritation in treated areas, and possibly lung damage if large areas of lungs receive radiation. Targeted therapy. Targeted therapy uses drugs that target specific vulnerabilities within cancer cells. Some targeted therapies FDA approved for mesothelioma include bevacizumab, Avastin, and anti-VEGF drug aimed at blocking new blood vessel formation that allows tumor growth, rindapepimut, papinamab, and immunotherapy targeting the cancer antigen mesothelin, and nintedanib, Vargatef, a tyrosine kinase inhibitor believed to interfere with tumor signaling and growth. Targeted therapy aims to stop cancer progression more selectively than chemotherapy and may have milder side effects. Ongoing research evaluates new targeted agents for advanced disease. Immunotherapy. Immunotherapy seeks to boost the body's own immune system to recognize and attack cancer cells better. Immunotherapies approved for mesothelioma include the checkpoint inhibitors nivolumab, Opdivo, and pembrolizumab, Keytruda, which help release the brakes suppressing anti-tumor immune responses. Research also investigates therapeutic cancer vaccines and other immunotherapies for mesothelioma. While immunotherapy side effects are often milder than chemotherapy, immune-related side effects may still occasionally arise involving the gut, lung, or other organs due to overactive immune responses. Combination treatment testing chemo or targeted agents alongside immunotherapy aims to maximize treatment benefit. Proton beam radiation therapy. Proton beam radiation uses accelerated subatomic particles, protons or other ions, or electromagnetic radiation, X-rays/photons, to precisely target tumors while avoiding much healthy tissue damage. Proton beam therapy in particular can treat mesothelioma tumors lodged in vital organs or close to the spinal cord, since protons deposit most radiation at the tumor and allow little radiation exposure beyond. However, proton beam therapy is still an investigational treatment for mesothelioma and its availability is limited due to high costs and lack of coverage by many insurance plans in some areas. Side effects with this technique aim to be fewer than photon radiation but depend on specific treatment plans. Clinical trials. Clinical trials research investigates new treatment combinations, cellular therapies, gene therapies, vaccines, and other cutting-edge therapies for malignant pleural mesothelioma and other cancers. Some trials combine standard therapies in new ways while others test entirely new treatment approaches. Participating in a clinical trial allows close access to a care team specialized in mesothelioma and helps accelerate efforts to find more effective therapies. However, there are no guarantees a trial will benefit any individual patient due to variability in disease and response. Close monitoring occurs in trials. Some trials have added new treatment options to standards of care based on promising results, leading to improvements in survival rates over time. Palliative care. Since mesothelioma is typically an aggressive cancer that cannot always be cured, palliative care plays a key role throughout treatment and beyond to manage symptoms and optimize quality of life. Palliative care treats physical and emotional distress from cancer and/or its treatment using therapies like pain medications, nutritional support, oxygen therapy, anti-nausea medications, counseling and spiritual care as needed. The goal is adding life to a patient's remaining days by maximizing comfort and function despite active disease. Palliative care may start earlier and continue alongside other active anti-cancer treatments or, for advanced disease where cure is not possible, form the focus of medical care. Palliative care significantly improves quality of life, mood, and symptom burden for patients and families coping with this difficult diagnosis. Complementary therapies. Some mesothelioma patients use complementary or integrative therapies in addition to medical treatment. Complementary therapies have theoretical supportive or palliative benefits but are not proven cancer treatments. Options may include acupuncture, massage, yoga, meditation, dietary supplements, herbal medicines, or time in nature. While safe for many, complementary therapies should be discussed with doctors as some can interact harmfully with medical treatments. The goal is enhancing well-being, relaxation and stress relief, not replacing evidence-based cancer treatments. Much research still needs done on specific efficacies for mesothelioma. While surgery is potentially curative for very early diagnosed mesothelioma, the alternative options offer clinically meaningful benefits when surgery cannot fully remove tumors or for recurrent, metastatic disease. Combination treatment individualized based on disease factors aims to maximize chances for disease control and symptom relief when a cure may not be possible. Palliative care enhances all stages of care. Research continues developing new and improved therapies to treat his difficult disease.